My name is Mrs. Sophia Unominim Bright. I am Nigerian. We saw your hospital on the internet, and we got in touch with the hospital, and there was our first contact was Miss Yifat Mano, and she was wonderful, sent us papers for visas and all that, and it was quite easy getting the visa also. It was actually easier than we had thought it would be. Yifat handed, sent a mail, and Mr. Alexei took over from there. He made reservations for us, hotel reservations, and told us we'll be picked up, and also told us who the case manager was going to be and how she was going to meet us and, go with me to every appointment and all that. So we got in touch with her. Her number was included, Yuli, and we've been in touch with her since then. And after we arrived, there was somebody to pick us at the airport. And then Yuli also called to, know how we were, if we had arrived, and then to tell us what the appointment was going to be like and what time we were to get here, and then we took it on from there. We had the treatment plan sent before we left Nigeria, so we know the appointments that we had, to keep and all that. So as we arrived here, we had tests run, had blood tests and all that, and she explained at the time that it was normal tests necessary, for people who might require surgery. So we had those tests. We came with our MRI reports, and when the doctor looked at it, when we kept his appointment, he didn't think it was necessary for me to have another MRI done. There was also an examination, and he explained, what the diagnosis was, and explained what the treatment would be. He gave us options and explained what each option entails. Professor Shabat, yes. I'm going to have to do a minor discectomy, and well, actually I came in with a problem, of bulging discs, that were impinging on my nerve, on the spinal cord. Okay, I think applying pressure on the cord and affecting my right leg, and I also had lower back pain. Okay, so he showed us all that, on the MRI disc, showed us, where the problem was and what he would need to do. I'm scheduled for that on Sunday evening, and I'm told I'll come in, and it's not going to take time. I won't even need to stay in the hospital, to stay overnight. It's something that will be a procedure that will be done, and then I'll leave shortly after. There has been coordination, and it's been prompt, and we haven't, there hasn't been any stress, any hassles at all. I don't feel like I'm in a hospital, and so I'm relieved. I did not have to worry about anything at all,